TOURMALINE-MM1 was a phase 3 clinical study, and it was for patients with relapsed and/or refractory multiple myeloma. And we're talking about oral Ixazomib, and it was approved based on the results of this particular international trial. Here at ASCO, we're looking at a specific subset of these TOURMALINE-MM1 patients. And to do that, I'm with Dr. María-Victoria Mateos, who is an MD and a PhD and an associate professor at the Universidad de la Salamanca in Spain. First off, let's remind us of the overall results of TOURMALINE-1 before we go on.
The TOURMALINE-MM1 trial is a phase 3 randomized trial conducted in myeloma patients in relapse or refractory disease, in which Ixazomib, the first oral proteasome inhibitor, was added to lenalidomide and dexamethasone and compared with placebo plus lenalidomide and dexamethasone. 722 patients were included in this trial, and the benefit for IRD, Ixazomib, lenalidomide, and dexamethasone was observed in terms of median progression-free survival.
Now, in the case of who you're looking at, this is like a subset of patients?
Yes, here at the ASCO meeting, what we have done is a sub-analysis of this efficacy according to the different prior lines of therapy patients received. So I can say that most patients were previously exposed to bortezomib and thalidomide. Few patients were exposed to lenalidomide, and what is important to note is that some patients were even refractory to bortezomib and also refractory to thalidomide, and the benefit was maintained across the different prior lines of therapy, and the median PFS around 20 months was maintained in the different subgroup of patients. So safety profile was also acceptable according to the different prior lines of therapy, and I think that the main message is that if patients had been previously exposed to proteasome inhibitor, bortezomib, or immunomodulatory drugs, mainly thalidomide, these patients can safely receive treatment with Ixazomib in combination with lenalidomide and dexamethasone.
I mean, obviously, it's good news to know. Were you kind of expecting that there might be some differences depending on what they were treated with earlier?
Yes, it could be, because so at the end, IRD is a combination based on proteasome inhibitor and immunomodulatory drug, but second generation, PIs, second generation IMiD. So what is the efficacy of this three drug-based combination if patients had been previously received first generation proteasome inhibitor or third generation immunomodulatory drug? So the answer is that even though patients had been previously exposed to this first generation, they can receive the second generation proteasome inhibitor plus IMiD because they are going to respond also very well.
And this was a difficult population. I mean, these patients were refractory to therapy when they went into this.
Absolutely. This is a difficult patient population because they mean that bortezomib didn't work. And what we have observed is that this subset of patients can be rescued with Ixazomib in combination with lenalidomide and dexamethasone, so indicating that this combination is able to overcome the refractoriness to the prior treatment with bortezomib or mainly thalidomide.
Well, congratulations. This is really good news to know. I appreciate it. And for ASH Clinical News, you'll notice that we have a variety of coverage, both in print and online, from ASCO 2016. Please check that out for American Medical Communications. I'm Executive Editor Rick McGuire.